Hi everyone, welcome back to the MSK MSO YouTube channel. I'm Jana and today I'm joined by Natasha, one of our incredible leads at MSK MSO, and she's with South Bay Neurosurgery, one of the practices we have with us. And Natasha plays a huge role in keeping things running smoothly, and we're excited to get an inside look at what she does today. So Natasha, thanks so much for joining me today.
Thank you so much for having me.
Yeah, so can you tell us a little bit about your journey? How did you get involved with MSK MSO?
Okay, so originally I found MSK MSO. Previously, it was just with San Diego Neurosurgery with Dr. Yu's clinic through a club at UCSD. That's where I go to college. Um, I was involved in the club, and one of the presidents there was involved in San Diego Neurosurgery. It was Shashir. He's a lead now with Dr. Yu's clinic. And I talked to him about his opportunities that he's gotten there, and I was a second year undergrad and I didn't really know many things about how to venture out, get clinical opportunities, research opportunities. So I was just trying to find something to set my foot in the door. And I asked him about all the details. I went ahead and applied, and then I got accepted with uh, Dr. Yu's clinic, San Diego Neurosurgery, and I am based in Chula Vista, California, and it was a little bit farther of a commute than I was used to, so with my school schedule and all of that, I struggled a little bit to be able to work in person. So I was working mainly remotely, which I wanted something a little bit more involved in person. I wanted to be with patients, take vitals, talk to people, learn directly from the doctor. And so I worked with Dr. Yu, and he let me know of a practice he was partnering with in Chula Vista called South Bay Neurosurgery with Dr. Daniel White, and that's who I work with now.
So that's such an inspiring journey. It's always amazing to see how different paths lead people in leadership roles. So, was there a moment when you knew you wanted to step up into a leadership role?
Yes, definitely. So with Dr. White's internship, I was basically the only one really there. Dr. Yu had a couple of his head interns head down every once in a while, but from them being from La Jolla, which is a lot more northern California, San Diego, northern San Diego, um, it was more of a commute for them in the opposite direction compared to me. So I was the first intern consistently there 15 hours a week. And from that, I was mainly working with certified, trained more adult professional MAs, medical assistants, and me being the only intern, I was like, okay, we don't really have much publicity or promoting of this other clinical internship. And since I'm from Chula Vista, I knew a lot of first generation Latinos and everyone like that interested in the medical field from my high school or adjacent high schools. And so I was like, this is a great opportunity that's local and can kind of help with some of those setbacks that those demographics face, such as myself. And so I decided that I wanted to begin promoting this internship in any way I could. So I began making flyers, and then I started promoting with San Diego State since that's more of a commuter friendly school and there was going to be more southern San Diego students more likely to be able to go to Chula Vista or be based more in Chula Vista or Otay Ranch. And so through that, I kind of started becoming a leader in itself. And as people came in, I was now the one designated to train them since, again, I was the only one really there. So I got lucky in the sense that I was able to move up the ranks very quickly since I was the first one there. But it was through my own efforts because I was trying to generate people to come in. And now I love to be a leader. I mean, it's very normal as a pre-med student that we like to be leaders, but my big thing is that I like to mentor people. So even though I'm kind of doing everything for the first time, I don't have much family that's involved in the medical field. I'm doing all my steps through my own networking, but I like to help people that also don't know, you know? So I try to talk to people and bring in people and help them feel comfortable and feel like they're learning many things. So just through that, I became head intern and then I became lead.
So that's a defining moment for sure. And it's really great to hear all the effort that you've put in to promote the internship. And I do believe that your lead role is very much well deserved because of everything you've done. And Yeah, leadership often finds us when we least expect it, but
Mhm.
just like you did, stepping up is what makes the difference. How would you describe your leadership style?
So, kind of like how I mentioned, my leadership style is teaching, and I like to just be very close with my interns. I don't like there to feel that there's a dynamic or a hierarchy or anything like that. Because, like, at the end of the day, I am their boss, but I do want to be their friend. And I feel like that makes it a very safe space for interns that they'll feel comfortable coming to me about any concerns, which is a big importance. I don't want them to feel overwhelmed, or maybe they feel like they're not setting the standard for themselves high enough and they kind of need that extra support. And I'm happy to give them that extra support. It took me a long time to be able to learn just the extent that comes with working in a neurosurgery practice. And I don't expect them to learn right away. I still make so many mistakes. And I just try to support them. I try to be a mentor and just always make sure that they feel safe and comfortable. If I need to tell them corrections or anything like that, they know I'm not being mean. It's just constructive criticism. And I always let them know that too, that like I'm never trying to be mean. The providers are never trying to hurt your feelings. You just, at a certain point, need to have a little bit of a tough shell, but it's never in a hurtful way. It's always with the best intentions.
Yeah, I love that. It really speaks to the way you approach your role and the impact you have on the team. Because, yeah, interns really do need leads who are understanding and supportive, and that's what you've done for them. Let's get into a little bit of a day in the life of a lead. Can you walk us through a typical day for you? What are your main responsibilities?
Okay, I'll focus when I was full time because I feel like that gives a better sense of what a true lead does. I'm a lead just only part time right now. So, day in the life of a full time lead, it is coming in at 8:30 a.m. every morning. We make sure that the charts for the week for the day are prepped and we go through every single patient that we're going to see, make sure imaging is done, make sure that they've completed all appointments necessary prior to the visit, and just making sure everything is easiest as possible once we get to them seeing the provider. And that's the first thing that kind of runs down. Sometimes it's a little stressful because the day might not be fully prepped yet, so we're kind of scrambling because sometimes you'll learn we get a little behind and you kind of just got to go with the flow. But that's how we start, and then usually we have someone sitting at the front desk. Right now, lately, it's our manager just because she's been focused on managerial things, but she's also an MA. And so she's in the front desk, and as patients come in, she checks them in, and we will go ahead and bring them in, take their vitals, height and weight. If the patient has a kind of a brain problem, we usually do an eye exam as well. And so we bring them into the room. With a follow-up patient, it's a little bit quicker. We have a quick questionnaire. We go through all of their symptoms and follow up again if maybe they haven't gotten some of those visits done yet, asking if they've gotten the appointment yet. If it was a referral that we ordered, we make sure that they got the information. Otherwise, we give it to them. We ask anything new, do a really short physical exam, and then we go to the provider, make a presentation about why they're here and what we are expecting for this visit. Provider comes in, we talk, we scribe for this visit at this point, and then provider explains imaging, we pull up imaging if it's necessary, and then we go ahead and make their follow-up appointment. With a new patient, it's a little different, and we're lucky in the sense that our providers really let us be very hands-on. And so with a new patient, we have a very long physical exam that we go through from top to bottom, all these muscle tests, reflexes, cerebellar exams, visual fields, and so we get to do that. The lead interns supervise the interns currently to make sure that they don't miss anything because these are important exams at the end of the day because they do lead to diagnosis if there is something wrong. So we just want to make sure they don't miss anything. So if it's just us in the visit, we'll do it ourselves. If not, we'll watch the intern and make sure they are documenting everything properly. And then same thing, we go to the provider, talk, go back into the room. So I'll take a lunch break at 12 and then all again until 4 o'clock.
Wow, that's a lot to juggle. It really shows how much goes behind the scenes. And how do you manage working with different teams, interns, and providers?
It's definitely interesting. It's a fun dynamic. So we work with two nurse practitioners and then Dr. Daniel White. So with Dr. White, we have our clinics a little bit more, I don't want to say slower because they're not slower. We still see the same amount of patients, but we definitely take more time as a group to review patient cases. So he likes to call, we call it the circle of trust. And we sit all together in the office, discuss a patient case that we're going to see in detail. He gives us some questions to quiz us, make sure we kind of keep up with our studies, and then he does a short lecture basically on the type of problem that we're seeing, what we need specifically for that problem for the visit, proper questions to ask. With our nurse practitioners, we have David and Eleanor. They're a little bit more fast paced. We kind of keep clinic flowing a little quicker and we keep running around, but organized. And so they kind of sometimes we get adjusted because Dr. White likes his notes a certain way, Eleanor likes her notes a certain way. Now that we're kind of building the internship more, they're starting to overlap. Before they were a little bit more different. Um, but it's awesome that we learn, they both have very different teaching styles, so we learn in two very different ways.
That's such a great approach. Keeping communication open and balancing different needs is really key to making everything run smoothly.
Mhm.
And for you, what's the most rewarding part of being a lead?
The most rewarding part, I think it's the mentoring. I love it personally. I love talking and teaching to people. My interns will say they know I love to talk. And so I just try to teach them as much as possible and feeling it kind of helps me kind of solidify the fact that like I am learning things because I'm sure so many people can agree with the imposter syndrome. You feel like you're not actually growing or you haven't really come to terms with the fact that you are learning so many things. And it's not just a normal thing to know. And so I love sharing knowledge because it helps someone in the long run. And I was lucky to have our manager and lead MA teach me everything I know apart from Dr. White, just kind of being in clinic. She was the main one to teach me. And so now I get to share all that knowledge. I think that's just really great. And then when you're in clinic more than just 15 hours a week, you do get a truer sense of how difficult everything is and all the moving parts that go along with it. Because when I was just an intern, I would come in 5 hours 3 times a week and be like, okay, hi, I'm here, and then bye, you know? But when I was working full time, I was like, wow, like, yeah, those 5 hours that I was there were not the whole day. It's when we're just the three of us, just the full-time leads working, and we have an intern, like, okay, that's great, we have some extra help. But then the rest of the day, we're kind of managing everything on our own. So it's definitely a different shift. But I think you just get a better sense of how everything functions. And it's just a great opportunity to learn kind of the background of so many doctors' offices that you, as a patient, you don't see.
It's always so nice to hear how leadership goes beyond task and makes a real impact on the people around you.
Hmm.
And can you share with us an example of a challenge you faced and how you solved it?
There's been a couple times that obviously we have some issues with an intern, maybe something was said that it was done and it wasn't done, or kind of stuff like that, kind of maybe falling behind, an intern not keeping up as hard as they should. For me, I've never really been one to discipline, so to speak. And so having to now have a sit down conversation with an intern and me having to lead the conversation on this is an expectation that wasn't met. How are we going to meet that expectation? That was something I was very much not used to. As much as I try to be a leader, I'm usually not the one doing those disciplinary roles. I'll teach people, I'll help, but I'm not in that type of leadership role. And so that was very new to me. And again, these are people I try to be their friend, so I feel like I'm getting my friend in trouble, but it is learning how to distinguish between I'm your friend, but then I'm also technically your boss. So it's a little bit just a new position of feeling. And I got used to it now. It doesn't happen very often where I have to be in that role, luckily, but when they're there, it took some getting used to.
It's a great example of problem solving in action. It highlights the importance of adaptability in leadership, right?
Hmm.
So when it comes to giving advice for interns and future leads, what qualities do you think make someone successful in a lead role?
I think what makes someone successful in a lead role, having a tough skin, because you're going to be told you did this wrong, this was bad, this wasn't great, you can do better. So, not that it's a bad thing to be told that, but sometimes it does throw you off and you're like, dang, like I thought I did a good job, but I still didn't meet standards. Or kind of becoming a lead, your standards are going to get even higher too, because now you're more experienced, you're put in this leadership role because you have earned it. So now let's have you work a little harder. So that was a difficult thing for me too. And I grew up in a home where we're very blunt and we take constructive criticism. I was a dancer for 10 years of my life, so some mean dance teachers too as you grow up with some constructive, sometimes not so constructive criticism. And so having that tough shell was very good for me because I knew it was never to take to heart or to think that they're just being mean to me or they hate me or something like that. It's because they know you can do better. And so kind of just being aware that you're going to get criticism. Don't always think you're perfect. And it's a hard thing to come to realization sometimes, but I think that's a great quality to have. And then, of course, to strive for intellectual greatness. That's always a great thing. No, you're always going to learn, but that comes with being able to take criticism.
Yeah, that's so true. I mean, sometimes it does hurt a little when you get criticized, but it's also a great step towards, improving yourself. So it
Mhm.
is also important to, take things in a positive way. And what about advices to interns who want to grow within MSK MSO?
I think a great thing is to go the extra mile. So we work directly with imaging. So we go ahead and look at the imaging prior to the provider and take photos of what we think the provider is going to want. If we are wrong, they will let us know and they'll take a new photo. But we try to do that for them. And I think that's where a big chunk of our learning comes from, being able to learn to read all those things and see imaging and see what these conditions we're talking about really look like in the photos. And so that helps us kind of learn a little quicker. But I think going the extra mile and looking up imaging, looking up what imaging isn't supposed to look like, all these different cases of different spinal cord compressions or different neurological conditions and how they might appear in MRIs. I think doing that really teaches you a lot. Learning a lot is going to go so much further for you because you're going to be more prepared in clinic when you're doing a presentation and they ask you questions that they expect you to not know. You might know them. So that's always feels great too as the student. And I think that's the best advice that was also given to me because it really does prepare you so much better.
Yes, thank you so much for that advice. And this was such a great conversation. Thank you so much for sharing your experiences and giving us a glimpse into your role. Your insights were really valuable, and I know they'll resonate with so many people who are looking to grow within MSK MSO. Thank you for joining us again today. And for those who want to learn more about MSK MSO and the incredible work being done there, make sure to follow us on social media and don't forget to subscribe to our YouTube channel to stay tuned for more interviews. So that's a wrap for today's video. Thanks so much for tuning in.